Good afternoon, Long Beach. Today's our briefing for June the 29th, 2020. We, of course, have these briefings multiple times a week just to update the community about COVID. And there is a lot happening as it relates to COVID-19, as we're probably all reading in the news or watching on the news as well. And so we do have our Director of the Health Department, Kelly Colopy, here today to give some additional information about what is happening and what the city is doing. We, of course, will have our Spanish translation through the Health Department after we do any questions. And then, of course, Paola is doing our ASL translation, as she always does for our update today. Before I get to the general update about where the numbers are, what happened with the governor's announcement around bars, and kind of what's next as it relates to COVID, I do want to announce a couple of, I think, really important initiatives that we're going to be launching today. The first is around Black health. We are aware, and you've heard this from our health director, our department, Dr. Davis, that our Black residents in our community are dying at a higher rate than their population as it relates to COVID-19. So the mortality rate, as we know, is affecting Black Americans across the country and those here at home in a way that is greater than any other population within the city. That's something that we have called unacceptable and tragic, and it's something that has to change, and there has to be a re-emphasis on supporting this, our community and the special needs that we have. We also know that in this era of protests and demanding change for racial injustice that exists within all of our structures, we also need to be very deliberate in the way that we support Black members of our community, the way we support the communities and the organizations on the ground, and the grassroots work that's happening on the ground as well. And so I want to talk about one initiative, and then I'll talk about the second in a minute. I want to announce today that I'm proposing a new initiative around Black health equity. This Black health equity initiative is a $1 million initiative to start that we will fund through the support that we're receiving from the state and the governor around COVID-19 and health. As you're all aware, we worked very hard to get additional support from the state to put in place strategies to increase safety and protect people here at home. And so the Black Health Equity Initiative will be a $1 million proposal to the City Council, and the staff will be bringing that forward, that will look at how we specifically target and support our neighbors and community members that really need our help and are dying at a faster rate. I also just want to note that last week I had a meeting with Black Lives Matter Long Beach. And of course, as you've been hearing on the street, Black Lives Matter has been making a series of demands and requests to the city, but also to the community and the country. One of the issues that they identified was exactly this issue, which is why we're bringing it forward, which is have a focus on Black health equity. This, by the way, is separate of all the other work that we have to do around police accountability, reform, the budget. Those issues are on their way. So those are issues that are coming soon. We're obviously doing the framework right now in the listening sessions. The budget season for Long Beach starts in just a couple months. And the city will propose a series of recommendations coming out of what we're hearing right now across the city in our protests, at our meetings, and in our listening sessions. But this equity initiative we're going to be announcing and launching today. And it was a key component of the work that Black Lives Matter Long Beach is doing in our city. And the other work that's really critical will continue to happen. And so that initiative we're also going to put money aside so that we can give the health department the capacity to create a training program and a program so they can train and support Black leaders and organizations in the community so that those organizations can build capacity as either nonprofits or community groups so that they are able to also do this work in the future and support this community and support our neighbors and our friends across the city. This, of course, initiative ties into the framework that we're all discussing and is really about equity. And so in the couple of weeks ahead, you're going to hear a lot more about this initiative, the initial $1 million that we're putting into it, and we hope that it really begins to bridge that gap in the inequity that exists. And again, this support is not going to solve this issue. It's a start of something that we have to do and have to do better at as a city. And so I wanted to announce that today. The second initiative, which is separate from the Black Health Equity Initiative, is another critical need that we've heard out in the community. We have right now, because of COVID-19, community groups all across the city that are working to help folks in different parts of the city. We'll also be announcing today, as part of our state budget and state funds receiving from the governor that we fought for in the budget, we're going to set aside $1 million for a new community recovery fund that will go directly to community groups in the city that are assisting with COVID-19 response. These are groups that are out there. This could be economic recovery. It could be needs around food. It could be needs around, obviously around health, but it has to be about COVID-19. That's a separate program that will be run out of the health department. And so both of these funds will be operated through the Long Beach Health Department. And we'll also be launching that in the weeks ahead. And both of these separate initiatives will be before the Long Beach City Council as proposals, and look forward to them being adopted and getting these resources out immediately. And so we want to make sure that organizations and that this work starts quickly. So I wanted to start by mentioning both of those. Let me now turn over to what's going on with the numbers and COVID. So as of today, we have 3,799 residents who've tested positive in Long Beach. This includes 757 cases since last Monday. We know we've had about 2,700 of them recover, and we've lost 130 lives to COVID. You're probably reading a lot about what you're seeing and happening across the county and the state. COVID remains a very serious challenge for Long Beach, for the county. As a reminder, even with Long Beach having the slowest and most cautious reopening cycle of any city, I believe, in Southern California, what's happening here and across the state is not enough to stop what's happening with this virus. There's still a lot of folks that are not taking, I think, the issue seriously. There's still a lot of business partners out there that have to tighten up their protocols. And as a state and as a city, we also have to do more to ensure that people are getting tested and that we're putting out these important messages. You probably know that yesterday, Governor Newsom mandated the closure of bars in 7 counties across the state, including LA County. This, of course, includes Long Beach. And Long Beach, even if we were counted as our own city, would not meet the criteria to have our bars continue to be open. So whether we're counted as the county or on our own, we don't meet the criteria. And we just heard today that Orange County also got put on a watch list. And so they are now on a watch list, and if their numbers don't improve, bars there, like in the other 7 counties, will also have to close. So we know that brew pubs, breweries, bars, pubs, wineries that do not serve food through a kitchen have closed. We know this is very difficult for the small business owners and the workers, and it's painful to have to make these decisions through the health department, and I know that, and our Dr. Davis, when she makes them with the health department, it is very hard for them, but it's in the interest of public health and safety. And I support the governor's actions because we know that he's being guided by the facts that are on the ground and the data that's on the ground. I also want to note that we have to be ready for how the rest of the week goes and prepared for additional rollbacks if that's where the conditions go and they get worse. I want to let people know that our hospitalization and our hospital capacity remain. We are still comfortable with where we are. It's not has not dramatically changed from the last report we gave as far as our hospital numbers, but we'll have more information on that later this week as we see what the reflection of this week. And I want to, in closing of this, remind everyone that we have in our hands the ability to prevent the spread of COVID-19. It's about wearing a mask, about being safe, about staying home if we can, being very cautious when we visit businesses, making sure businesses do the right thing, quarantining if we're around others or have been exposed, and knowing that our most vulnerable are still dying every day because of COVID-19. There is a sense growing across the state that this could get worse, and we don't know yet. And so please stay healthy and stay safe. And Kelly Colopy is now going to give us more information on where things are from a health perspective, and then we will answer some questions. Thank you.
Good afternoon, everybody. Happy Monday. So at last Thursday's press conference, I spoke to you all about our stability criteria. As I mentioned, we currently do not meet 2 of the 6 stability indicators, our case rate and our positivity rate, which means we're really holding back on opening up. So the case rate refers to the amount of COVID cases per 100,000 residents. For stability, our rate would have to be under 100 people per 100,000 or a positivity rate of less than 8% over 7 days. We have 187 case rate per 100,000, so we're well over the number. And our positivity rate today was 10.8%, which has gone up from 6% or 6.3% when we opened at our attestation. Then it was in the 8s, and now it's in the 10s. So the numbers are definitely going up. We are keeping a close eye on our hospital bed availability and our surge capacity and increases. Right now, they're looking still pretty stable. But elsewhere in the country, we're seeing hospitals quickly reaching capacity. In fact, Orange County has seen a jump in hospitalizations with an average daily increase of over 15% over the past 3 days. It is, you know, the virus is out there, and I really encourage you all to be paying attention. I'd like to share a little bit about the underlying health conditions. I get a lot of questions. So, like, how bad does your underlying health condition have to be before it actually impacts your ability to, you know, around COVID and your ability to recover from it? So basically what we find, the most up-to-date information, is that the CDC updated its health conditions. And what we find, the following conditions are an increased risk of severe illness. Those conditions, I apologize, let me find that page, are chronic kidney disease, COPD, immunocompromised from an organ transplant, obesity with a BMI of over 30, serious heart conditions, sickle cell disease, or type 2 diabetes. So those are the ones for which you would consider to have like the likelihood of more severe complications from COVID. Additionally, there are a number of conditions that might be linked to an increased risk. Those include moderate to severe asthma, cystic fibrosis, hypertension, other immunocompromised diseases, neurological conditions such as dementia, liver disease, pregnancy, pulmonary fibrosis, smoking, or type 1 diabetes. So if you do have any underlying medical condition, you should plan to continue to follow your usual treatment plan. Continue with your medicines. Don't change your treatment plan without talking to your healthcare provider. Have at least a 30-day supply for prescription and non-prescription medicines. Just in case you're going to have to isolate or quarantine, you want to make sure that you have it available to you. Do not delay getting emergency care because of concern about your underlying health condition. Because of COVID-19, please make sure that you access the care that you need. Remember that the risk is a continuum. In other words, everyone is at risk of COVID-19 if they are exposed to the virus. It just might look different for different people. So while some people are statistically more likely to become severely ill, at no time is anyone completely safe. It's incredibly important for anyone at any age, but especially those at elevated risk, including older adults, to take necessary precautions to prevent becoming infected. And I also want to close today as just a shout out. So I want to share with you that many of your Health and Human Services team have not taken a single day off since this all started in early March. They're working 16, 18 hours a day, every day, to make sure that you are as safe as you can be. You hear a lot about the healthcare workers, but there's a lot of work going on behind the scenes around public health that I wanted to share. Our team is working so hard to make sure you have the most current information, that there is testing, all those drive-thrus, that's who's pulling this together, to investigate cases, to provide sheltering for people who are homeless, to provide food and food distribution, supporting older adults, providing safe isolation and quarantine sites, and so much more. We understand that income is also essential to the overall wellness of our community, and because of that, we're working as much as we can to open the businesses, but all of you have to do your part or we're going to have to pull back. So bars are only a first step. I know many of you believe you'll be fine if you get sick, and you might be, but exposure and transmission in the city is real. You might be fine, others around you won't be. So I live in Long Beach. I walk my bike around, I see all the communities. There's so many people who are doing the right thing, and I thank you. But there's also so many people who don't have their face coverings on, or I walk by a restaurant and the line is long. I ask you, please do your part. So when Dr. Davis and I stand in front of you every week, imploring you to do the right thing, we do so with you and your loved ones in mind, as well as our great city of Long Beach. We ask you to please help us out. It really does matter for all of you to do your very best, to follow all of the rules, to wear your mask whenever you are out, to make sure you're keeping your distance, make sure you're washing your hands. I know you're tired of the message, but we'll know that you have gotten enough and that you're tired enough that you'll actually start following it, and then we'll all be in better shape for our city. So with that, I'm going to turn it back to the mayor. Oh, there's questions? Anyone have questions?
We have one question from the media. The question comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hey there. So hospitalizations are rising quickly in LA County, but the number of hospitalizations in Long Beach appear to be relatively flat. But we also know that our hospitalizations in the last 2 months have been pretty unreliable and often updated significantly after the initial reported day. So is late reporting the reason why we're not seeing hospitalizations go up in Long Beach? And if so, is the city working to fix this problem?
So we've actually really tightened down our reporting, so we don't consider it really late reporting anymore. What we do find is the day that something reported, we do count back a few days before we actually report that number. So, but that's happening across the county. So when you look at the hospitalization rates, they have you count back a certain number of days and then take the average. So for none of the jurisdictions is it the day of specifically. What you'll see is when we report to you, that's the day we got the reporting. But the data that we provide every day on the website, those are the most current and up-to-date is the dark blue bar that you can be paying attention to, as well as the hospital stability indicators.
Okay, Kelly, we have one more question on social media. Should I wear a mask while working out, taking a jog by myself?
We actually don't encourage people to wear face coverings while they're exercising with elevated heart rates and elevated breathing, because that can be dangerous as well. If you're out on your own, we encourage you to take the face covering with you. So if you end up in a group, that way you can make sure that you're not around anybody within 6 feet. But if you're out on your own, just carry it with you, but you don't have to have it on at that time.
All right, we have one more question from the media. This comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hey there. Sorry, I emailed this question earlier, but I thought I'd just ask Karen instead. So we've gotten some calls from readers saying that, they've had their COVID testing appointments moved from, Vet Stadium to the PCC campus kind of last minute. I even had that same experience on Friday from Jordan to the Vet Stadium. Given, that the testing appointments are in high demand right now, why are they getting moved around so often and last minute?
So the primary things, Jordan High School had a bunch of construction, and the timing, we didn't learn about it until it was close to the timing, so we had to move people around and do our very best to get people associated with appointments there. So sometimes there's some interference with the test sites. They come, we don't always know about them with enough advance notice to give people the advanced ability to schedule their tests, and then we do everything we can to make sure that people can hold those tests within that day or so.
All right, thank you. That's the last question for today.
Thank you.
Now we will have Spanish translation.
Muy buenas tardes, gracias por acompañarnos hoy en nuestra sesión informativa del 29 de junio. Queremos empezar con dos nuevos fondos para la ciudad de Long Beach, o presupuestos de fondos para la ciudad. El primero es un fondo que será para la equidad y salud para la comunidad negra. La tasa de mortalidad con todo eso lo que tiene que ver con el coronavirus y generalmente con la salud de nuestra comunidad negra siempre hemos visto que son afectados con números más altos que los demás en la comunidad. El plan es para financiar una propuesta de $1 millón para apoyar a nuestra comunidad directamente afectada por el coronavirus. Tuvimos una reunión con algunos de los líderes del grupo Las Vidas Negras Importan del área de Long Beach. Estamos preparándonos para esto y otros problemas. Sabemos que esto es totalmente separado de los otros problemas como la brutalidad policial y los presupuestos, ya que todavía tenemos que llevar a cabo las sesiones de escucha que están pasando en la ciudad. El segundo presupuesto es un fondo de recuperación del coronavirus para la ciudad de Long Beach en general y los fondos serán parte de los programas abajo del Departamento de Salud adicionalmente. Y estos dos presupuestos de fondos serán discutidos y estarán en la agenda de la reunión de la alcaldía mañana por la tarde. El grupo concejal notará y votará sobre estas iniciativas mañana. Ahora, para darle nuestros últimos datos del coronavirus, desde hoy han habido 3,799 residentes que han sido positivos del coronavirus. Este número incluye un aumento de 757 casos desde el lunes pasado. Aproximadamente 2,750 personas se han recuperado y hemos perdido a 130 residentes de la ciudad. 97 de esas muertes han sido asociadas con los centros de enfermería de largo plazo. La cerradura de los bares en la ciudad de Long Beach durante este fin de semana pasado, el gobernador Newsom ordenó el cierre de bares en 7 condados en todo el estado de California, incluyendo esos que están en el condado de Los Ángeles. Y desde hoy este mandato se aplica a cervecerías, distillerías artesanales, cervecerías, bares, y bodegas y salas de asociadas que no sirven, esos negocios que no sirven comida en la ciudad de Long Beach. Estas empresas que tienen un permiso de restaurante y sirven comida pueden continuar operando, pero solo con tal de que estén siguiendo protocolos de seguridad y asegurándose que están siguiendo precauciones y pólizas para proteger a sus empleados y para proteger a la comunidad y sus clientes. Es un esfuerzo para limitar la propagación del coronavirus a medida que el Estado continúa reabriendo. El Estado desarrolló una lista de monitoreo para los condados que se enfoca en indicadores claves como la tasa de positividad, la tasa de casos, la estabilidad de hospitalizaciones y la capacidad de sobreintensión del hospital. Los condados que no cumplen con estos criterios se colocan en la lista de monitoreo y los condados que han estado en lista por más de 14 días que se cierren son los bares. Según las pautas estatales para el proceso de reapertura, Long Beach, que tiene su propio departamento de salud, se cuenta con el condado de Los Ángeles. Como hemos dicho muchas veces, continuamos basando nuestras reaperturas en hechos y en nuestros datos. Basamos todo lo que hacemos con la ciencia, no nomás por hacer una decisión. Debido al aumento de casos tanto con el condado en Los Ángeles como en nuestra ciudad de Long Beach, además de las recomendaciones de nuestros profesionales de salud pública, nosotros apoyamos al gobernador de California. La orden de salud modificada que refleja este mandato se encuentra en nuestro sitio de web de longbeach.gov/COVID-19. Puede tener más información en ese sitio. La directora Kelly Colopin hoy nos trajo más información sobre el estado de los criterios de estabilidad. La conferencia de prensa el jueves pasado hablamos de nuestros criterios de estabilidad y como mencionamos, actualmente no cumplimos con 2 de los 6 de indicadores de estabilidad, nuestra tasa de casos y nuestra tasa de positividad, lo que nuevamente significa que hemos tenido que reducir nuestras reaperturas. La tasa de casos se refiere a la cantidad de casos de coronavirus por cada 100,000 personas o 100,000 residentes. Para la estabilidad, nuestra tasa debe ser menos del 8% en lugar de 7 días. En Long Beach estamos a 187 de cada 100,000 personas. La tasa de positividad se refiere al número diario total de pruebas y coronavirus realizadas y de esas pruebas cuántas son positivas cada día. En Long Beach nuestra tasa actual es de 10.8. En la semana pasada estábamos a 8.4. Ha subido y van a seguir subiendo. También estamos vigilando de cerca la disponibilidad de camas en el hospital y nuestra capacidad de aumento debido a estos aumentos de números. En otras partes del país estamos viendo que la capacidad rápidamente está subiendo. Más cerca como de nosotros, aquí en nuestros vecinos en el condado de Orange, están viendo que ha subido más de 15% las hospitalizaciones. Ahora, alguna información que salió, el departamento del CDC nos avisa que nos mantengamos actualizados sobre cualquier información nueva como esta que pueda afectarnos a nosotros y a los miembros de familia, especialmente a nuestros miembros de familia que tienen enfermedades crónicas o enfermedades subsiguientes. Queremos que sepan que el CDC salió con una lista de las condiciones de salud. Las personas de cualquier edad, con cualquiera de las siguientes condiciones, tienen un mayor riesgo de enfermedad grave, que son las enfermedades renal crónicas, que tienen que ver con los riñones, una enfermedad pulmonar obstructiva crónica, problemas con su sistema inmunológico, obesidad, sobrepeso, enfermedades cardíacas graves, enfermedades de células y el diabetes tipo 2. Nomás queremos recordarles que es muy importante tener mucha más precaución cuando tiene alguna de esas enfermedades crónicas. Si tiene una afección médica subsiguiente, por favor, siga su tratamiento como le dice su doctor, siga llamando a sus doctores si es que no necesariamente es una emergencia o quiere nomás asegurarse de sus planes médicas. Continúe sus medicamentos y no cambie su plan sin hablar con su proveedor médico primero. Tener al menos un suministro de 30 días de medicamentos, sean con receta o sin receta. No demore en obtener atención de emergencia para su afección médica. Y si tiene proveedor de atención médica, puede comunicarse a nuestra línea de información, que otra vez el número sigue siendo el mismo, 562-570-4636, y ahí le podemos ayudar. Recuerde, sin embargo, que los riesgos continúan y, en otras palabras, todos corremos el riesgo de contraer este virus si están expuestos o están cerca de alguien que tenga el virus, mientras que algunas personas son estadísticamente más propensas que otras a enfermarse gravemente. En este momento se sabe que ningún grupo de personas está completamente a salvo de enfermarse gravemente. Es increíblemente importante para cualquier persona de cualquier edad, pero especialmente aquellos con riesgos elevados, incluidos a los adultos mayores. Quiero tomar un momento también para agradecer a los trabajadores de salud que han estado trabajando, no necesariamente médicos y enfermeras, pero todas las personas que están trabajando para asegurarse que hay recursos como comida, todas las personas que están trabajando en los centros y los sitios de pruebas. Recuerden que siempre sigan usando sus coberturas faciales cuando salgan al público, lávese las manos con frecuencia y practique distanciamiento físico. Sabemos que hubo una pregunta hace un momento sobre los cambios de los sitios de examen y los sitios de prueba. Si es que al último momento, por ejemplo, en la escuela Jordan, llegan las personas, desafortunadamente a veces no nos llegan los datos que hay construcción en la calle y tenemos que cerrar ese sitio. Y generalmente lo que no queremos hacer es cancelar esas citas que ya están disponibles ese mismo día. Lo que hacemos es, si hay otro sitio que está abierto en otra locación, a veces nomás transferimos esas citas a ese otro lugar. Sabemos que es a veces un problema, a veces no nos avisan hasta el último momento que nuestro equipo llega a estos sitios. Sí, los cambios son de último momento, pero lo último que queremos hacer es cancelar su cita. Gracias de nuevo por tener paciencia con todos los cambios de último momento. Para hoy, creo que es todo. Muchas gracias por acompañarnos hoy. Thank you so much for joining us today. We will see you on Thursday at 3 p.m. Thank you.